Hello friends, today I will be speaking about tetanus toxoid vaccine. So let's first see few points about tetanus disease. It is caused by the Clostridium tetani bacteria, which is gram positive. The bacteria are seen as spores which are ubiquitous and present in soil, dust, human and animal intestine. The incubation period for tetanus is 2 to 21 days. The spores need anaerobic condition for their germination, and once they get germinated, they will release the toxin. And this toxin is a pathogenic agent for disease causing. And the toxin get traveled from local production site to the neuromuscular junction or to spinal cord level in retrograde fashion. This is a picture showing the drumstick shaped spores we can see here. So let's see about toxin pathogenesis. There are two types of toxins secreted by spores. One is a tetanospasmin and second is a tetanolysin. Among these, the tetanospasmin is a culprit for tetanus disease. It acts as a presynaptic layer. Here we can see, and it will block the release of inhibitory transmitter, so which leads to the continuous stimulation by excitatory transmitter, causing the agonist and antagonist muscle spasm. And patient will show the symptoms like jaw lock, opisthotonous posturing, or painful muscle spasm. And we should be knowing natural infection won't protect against the future disease or infection, so we need the vaccination for future protection. And this figure is showing the retrograde transport of the toxin from local injury site to the spinal cord level. So what we can do to prevent the tetanus? So we have two tools. One is a vaccine, second is a immunoglobulin. So first let's see about the vaccine. Nowadays standalone tetanus toxoid vaccine is not available. It is only available as a combination vaccine like DPT, TD or Tdap, and each dose contains 5 LF units of tetanus toxoid and aluminum phosphate as a adjuvant. For age less than 7 years, we use the DPT vaccine, which contains the acellular or whole cell pertussis component. And for age more than 7 years, we use the TD or Tdap vaccine. The routine schedule for vaccination includes 3 primary doses at 6, 10, 14 weeks, followed by booster dose at 1.5 and 5 years, then TD injection at 10 years of age and 16 years, and then followed by every 10th yearly, that is decennial doses. Then what is the catch-up vaccination schedule for vaccination in unimmunized patients? So 4 doses are recommended, 3 are primary doses and 1 is booster. Among these 4 doses, first dose should be Tdap and subsequent doses can be TD. So this is a table showing the vaccination schedule. So we can see day 0, 1 month and 6 months. These are primary doses, 3 doses, followed by the booster, which should be given at least 1 year after the last dose. This last column is showing the duration of protection after each vaccine dose. So we can see after first dose there is no protection, so it acts as a sensitizing dose. Only after second dose, means when patient takes the 2 doses, the patient will be immune, so for 1 year. And if he takes the 3 doses, then he will be protected for 3 to 5 years. And if he receives his booster dose as per the recommendation, then he will be protected for at least 10 years. So this is a graphical representation showing the immune response to tetanus vaccine. We can see this X line, X axis is representing the number of vaccine doses and number of days, while the Y axis is representing the protective antibody titer. This lower figure here, this blue shaded area, and the line above this shaded area, this line demarcates the protective antibody titer. So we can see after first dose, this is the first dose, there is only minimal antibody rise, which is below protective level. Here also we can see minimal or no antibody level rise, and only after second dose we will get the protective antibody titer. Here also we can see, and with subsequent doses the antibody titer rise will be more. So, and this is a response to the booster dose. So we can see with one booster of we will get the enough antibody titer rise. So for tetanus disease, the wounds are categorized into 2 categories. One is a clean minor wound and second is a tetanus prone wound, which includes the wounds contaminated with the dirt, feces, soil and saliva. Puncture wounds like nail injury, avulsion, crushing, burn or frostbite injury. So if any patient comes with an injury or wound, then how you will approach that patient? So you should be considering 2 points. First is the type of injury, as I explained, the clean minor or tetanus prone injury. And second, you should ask about the vaccination status of the patient, whether he is completely vaccinated, partially vaccinated or unvaccinated. Then based on these two questions, you will be able to take decision whether he needs the vaccination, if the vaccination will be protective if we give him that vaccination, and whether it's safe to give the vaccine in this patient. So this is a flow chart showing the approach to this type of patient. If patient is unvaccinated or partially vaccinated and he is having the tetanus prone injury, then he will need the TIG, that is tetanus immunoglobulin, and injection TT. And if he is having the clean minor wound, then he will only need the injection TT. And if patient is completely vaccinated, then irrespective of the type of injury, he will only be needing injection TT. The standard dose for tetanus immunoglobulin is a 250 international unit intramuscular among all age groups. And there is one scenario, special scenario, the HIV or immunodeficiency patient with tetanus prone injury will need the both injection TT and immunoglobulin irrespective of their vaccination status. So this is roughly the chart showing the duration of protection. If patient is completely vaccinated, then he will be protected from tetanus from clean minor wound for at least 10 years, and from tetanus wound for at least 5 years. So antenatal mother, so we will see the vaccination protocol in antenatal mother. If mother is primary or comes for the first pregnancy, then 2 doses of tetanus toxoid containing vaccines are recommended. Among these, the first dose should be given at the first contact, means after confirmation of pregnancy. Whenever mother come to hospital first time, the first dose should be immediately administered, and subsequent next dose should be given at least 4 weeks apart, and preferably after 20 weeks of gestation. And if mother comes for subsequent pregnancy like second or third pregnancy, then we should see the gap between the current pregnancy and previous pregnancy. If gap is less than 3 years, then only 1 dose of injection TT is sufficient, and if gap is more than 3 years, then 2 doses of tetanus toxoid containing vaccines are recommended as shown above. And it is advised to replace at least 1 dose with Tdap rather than giving the both doses as a TD, and preferably the second dose should be given at least 2 weeks prior to the delivery. This will facilitate the enough antibody titer from mother to baby. And we should be knowing why at least single dose of Tdap should be given. The pertussis is having the more mortality and morbidity in infantile period compared to the pediatric or the adult. So if we vaccinate the mother during pregnancy, this will protect the baby. So it will cause the protective antibody titer from against the pertussis transfer from mother to baby, and baby will be protected for initial period of life. So after that, he will get his own vaccination and he will build his own immunity. So how to approach if baby less than 6 weeks comes with an injury to your clinic? So what is the role of vaccination? We know first dose won't give any protection. It acts as the only sensitizing dose. And incubation period for tetanus is up, it can be as low as 2 days. So vaccine won't protect. Then next question you should ask is a type of wound. Here also, if patient is having the clean minor wound, there is no need of vaccination or immunoglobulin. We can wait till 6 weeks of age and then start vaccination. And if baby is having the dirty wound, that is tetanus prone injury, and mother is unimmunized, or she had received less than 3 doses, or she had not received her booster dose during pregnancy, then injection tetanus immunoglobulin should be given. So nowadays we can see it is common scenario. Every other patient with some injury come to your clinic and he will ask directly injection TT. So why there are recommendation to avoid the repeated extra doses of injection TT. So we should be knowing repeated extra doses than recommended will cause the increased reactogenicity, leading to local and systemic side effects. This can cause the severe Arthur's type 3 reaction and serum sickness. So what is this Arthur's type reaction? Here the patient will be having already high level of protective IgG antibody against tetanus toxin, and once you administer the injection TT, the toxoid antigen will get bind to this circulating IgG antibody, and this immune complex of antigen and antibody will get deposited in dermal blood vessel, dermal capillaries, and this will cause the local vascularity changes where we can see, and patient will show the symptoms like erythema, redness, induration, tenderness, pain, and these symptoms will be seen within 6 to 12 hours of administration of injection. Most of the patients, these symptoms will be mild to moderate and they will subside on their own. So if patient develop the arthritis type reaction to the injection TT, then he should avoid the vaccination for next 10 years. So let's see what are the contraindication for injection tetanus toxoid vaccine. So anaphylaxis to previous dose and history of severe allergy to any vaccine component. These are two contraindications. And what are the precautions for injection TT? First is a GBS within a 6 weeks of previous dose of injection TT, and where other causes of GBS are ruled out. And second is a moderate to severe acute illness, and third is a arthritis type reaction as explained above. So let's see how to carry vaccine at home. Nowadays many patients will purchase the vaccine from pharmacy and they will get it injected from local clinic or sisters or anyone known to them. So we should be knowing the tetanus vaccine get freezes at -3 degrees Celsius, and the freezing causes the decreasing potency of vaccine and increasing reactogenicity. So vaccine should never be carried directly in contact with the ice like this or that ice pack they will give. It should, we can carry it in cold water or we can carry it in our pockets if we are going to take it soon, as this vaccine is stable at room temperature for 7 days. Thank you.